The Ethical Implications of Smart Medical Bracelets by Melissa Ryan and Sheena Bove. The phrase, "there's an app for that," has been uttered countless times, and now in 2015 we no longer have only an app for that on our smartphones, we now have an app for that on our smart bracelets and watches. The Fitbit, Jawbone, Nike FuelBand, Pebble, Android watches, and now Apple Watch are just a few of the new devices starting to gain wide adoption. We'll get to see how they'll fit into our lives in both expected and unexpected ways. In particular, it'll be exciting to see how these smart bracelets and watches are used in areas more specific to the medical field. For example, Rush University Medical Center in Chicago is using a new system with bracelets that use smart card technology. The bracelets are loaded with a patient's identification, date of admission, and their physician's contact information. The bracelets can be used to track patients' location and movement in the hospital. They can also help prevent the dreaded code pink that indicates a baby has gone missing. So far, these smart bracelets have been adopted more widely in European countries such as France and Germany, where privacy regulations are not as strict as in the United States. In the future, different types of medical bracelets may contain more information such as the patient's medical history, insurance information, access to rooms and facilities in the medical center, and may serve as a vehicle for payment for services. They may soon allow the doctors and nurses to connect their tablets and read and write information to the bracelets, including next steps or notes. Argo Design, the company led by the designer of Disney's Magic Bands, has been exploring the medical bracelet idea. Magic Bands allow Disney visitors to conveniently pay for food, skip through lines, and unlock their hotel rooms. It tracks their habits and spending, among other things. Argo Design believes a version of these bands optimized for hospital use could monitor patients' vital signs and alert nurses and staff of any trouble, as well as prevent patient mix-ups and medication errors. Another new type of smart medical bracelet is the Embrace Alert Band. The MIT lab developed the Embrace originally, and now it's the product of a company called Empatica. Empatica is an effective computing company focused on human data analytics, and their mission is to develop groundbreaking wearable devices with medical quality sending technology. The Embrace Alert Band monitors electrodermal activity or changes in the skin caused by autonomic nervous system. This means that through sensors in contact with the skin, it detects physical, emotional, and cognitive stressors. The band is being applied in clinical research to monitoring and detecting epileptic seizures. According to the Institute of Medicine, 1 in 26 people in the U.S. will suffer from epilepsy at some point in their life, and roughly 65 million people worldwide suffer from the disorder. It will allow people with epilepsy to seek help or to get out of a potentially unsafe situation before the seizure occurs. Additionally, the band can send an alert to family members wearing the companion Embrace bracelet to let them know when they need to help. The alerts can also be sent to smartphones of roommates, caregivers, or other people so they can check on or assist. Other applications of the Embrace may soon include research on sleep disorders, addiction, hypoglycemia, Parkinson's disease, post-traumatic stress disorder, diabetes, and many other health issues. Adoption of medical smart bracelets and smart watches will provide many great advantages in the health and medical fields. However, with these new systems and technology, there are many ethical implications to consider. A prime concern with collecting, storing, and transmitting this sensitive information is data security and personal privacy. Empatica's website states, "We take a great deal of care into protecting your personal information. The data are ultra secure and private with state-of-the-art encryption. We think data about yourself should be owned by you. We might ask you to allow your data to be used to improve research and benefit science, but every system will be opt-in, and you can choose freely to participate or not." Unfortunately, as we know, security breaches of sensitive data happen quite often. According to a recent Reuters article, a person's medical information is worth 10 times more than their credit card number on the black market. And hackers have been targeting the healthcare industry in part due to its aging computer systems that don't keep up with the latest security practices. With financial or credit card identity theft, people generally know quickly when their security has been compromised, as unauthorized purchases show up on their accounts. But with medical identity theft, criminals are able to use the credentials for much longer. According to the Ponemon Institute, a think tank on data protection policy, the percentage of health organizations that have reported a cyber attack rose from 20 to 40% from 2009 to 2013. The Medical Identity Fraud Alliance also maintains a database that shows that fraud involving the Medicare program for seniors and the disabled totaled more than $6 billion in the last 2 years. As mentioned earlier, the adoption rate of these technologies is higher in some European countries. This may be in part because many have universal healthcare systems where everyone is accepted regardless of pre-existing conditions. France, for example, is considered to have one of the best-rated healthcare systems in the world. The healthcare system in the United States, unfortunately, is very driven by commerce. Speaking in terms of ethical frameworks, particularly the utilitarian framework that's concerned with the overall consequences of an act, if the devices cut down on overall administrative costs, increase efficiency, and reduce mistakes in delivering healthcare, their use is ethically sound. Another ethical consideration of medical smart bracelets is the cost of the devices. Many of these devices are far out of financial reach for a large percentage of the population, both in the United States and abroad. Not everyone that needs or could benefit from a potentially life-saving device like the Embrace, for example, has access to it. Although there are some serious challenges with widely implementing these technologies, overall it would bring about more good. If people are resourceful enough to think of and use these bracelets in innovative ways, we are definitely equipped to tackle the obstacles that come along with adopting these new technologies. Sheena's up next with the rest of the presentation. Thank you.
Thanks, Melissa. Apple is well known for providing positive user experiences across a variety of products and has been a trendsetter for design in both hardware and software industries. Apple, which seems to be ever expanding, has now wandered into the realm of wearable technology and medical research. They were recently granted a patent that could revolutionize wearable technology and greatly improve some of the existing wearable tech that was mentioned earlier. One of the Apple patents I'd like to talk about is the battery-free microwave frequency communication device. This device could wirelessly transmit data to a disposable hospital band. The band would contain sensors stored data which can transmit back to a device. This autonomous battery-free microwave frequency device, patented by Apple, can be used in objects such as flyers, wristbands as mentioned earlier, cards, and more. It allows for the back and forth communication between the device and a smart device such as an iPhone or tablet. This could allow data to be stored on the hospital bands for patient information such as vitals, prescriptions, allergens, insurance information, and more. Doctors and nurses could even store notes on the bands and track patient whereabouts. The next thing I'd like to talk about is Apple Research Kit, and I'd like to share a quick video.
I've spent a large part of my career focused on a number of different diseases, from obesity, diabetes, heart disease, Alzheimer's, and one of the problems has really been around our ability to understand what's actually going on in those diseases.
The key to understanding health and disease is research and data. What all researchers want is measured, quantitative, objective data.
Well, up until now, when somebody wanted to do a research study, they might, put up a bunch of flyers around and hope somebody comes along and tears off the phone number. Methods for conducting medical research haven't really changed in decades.
We have sent out over 60,000 letters. Those 60,000 letters have netted 305 women.
We really do need to transform how we do research, and the iPhone, with an ability to collect data, could be a powerful tool for research.
Research Kit is a framework. It's a framework that enables medical researchers to more easily design the apps that they're going to use for clinical studies.
We're talking about trying to change the scale of the amount of data that we can collect. Going from data that might be collected, say, once every 3 months, to data that's collected, say, once every second. The iPhone's being carried now by millions of people all over the world. So to think that this device that you use to check your mail or Facebook can be used to battle disease is really simply amazing.
The concept that I could kick out a survey to patients every day, every week, that would show up on their phone and would actually improve their health and our ability to care for them. That's a game changer. That is awesome.
We can now engage unprecedented numbers of individuals in large geographic areas, many of which have never been able to participate in research.
Half of the Parkinson patients in the world is in China. China has the largest number of mobile phone users, which means that we can collect more information so that can give us more accurate estimate on things for the research purpose.
What we're building into this platform are simple structured tests that people can go through, things like tapping or a voice test. And this can all be done using the built-in sensors on the device and a little bit of code. One of the things that Research Kit will do is put people at the center of research, giving people the insights and the tools they need to live better and healthier lives.
It's going to change research for every condition that's out there, and that just makes it very accessible to patients. The easier you can make it for people to participate, the better off you're going to be.
I want to leave a legacy for my granddaughter. Maybe when she's 25, they'll come up with, oh wow, that research study that was done in 2015, with the iPhone was really key in making a breakthrough on how we can better help asthmatics. She'll say, wow, my grandma was a part of that.
Putting the solutions in the hands, literally the hand with an iPhone of the patient. This is the answer. This is exactly where medicine is going. It has to. It has to.
So, we know that Apple Research Kit is an open source software framework that allows researchers and developers to easily create medical studies which can be conducted using the smartphones or watches. The framework currently uses the iPhone to run physical tests using the existing sensors and can prompt surveys, gather medical history information, and even measure physical movement. Research Kit may also be used to create apps for the Apple Watch that could gather more information through more specific sensors, such as heart rate, temperature, and more. Of course, there are some privacy concerns that come into play with this new technology. Individual data collected and transmitted is not stored on the phone, and researchers must ensure that participants understand the risks and that their data is secure. Although the data isn't shared with other clinics or universities, it is possible that research groups could sell the information to other groups or even pharmaceutical companies. This could cause targeted ads to show up for participants, or the data could potentially be sold again to other groups by the pharmaceutical companies. Businesses could take advantage of this data, and they could target very specific markets with ads and new products. One benefit to this could be that products may be developed to target specific needs that may not have been known before. However, participants may not want ads targeted to their health issues being displayed throughout their web browsers. Many more ethical issues could arise with big businesses trying to make money in the medical field through these studies. Participants need to be fully aware of the potential risks. We also may run into issues with non- or false compliance. There's no way to really ensure that participants are being honest. It is easy to verify a participant's identity in person, but it becomes much harder in a virtual environment. Some don't see this as an issue. John Wilbanks, the Chief Commons Officer for Sage Bionetworks, a company that has already launched 2 clinical studies using ResearchKit, states that they are more worried about trolling and impersonation than fraud. Wilbanks makes a good point, stating that there is no public payoff for their studies, and they are quite lengthy, so they may not have to worry about impersonation or trolls so much. However, some studies may offer some type of incentive for participants, and need to in order to bring in participants. But this could increase the risk for fraud. Another issue is that there is no way to verify whether or not the patient is actually completing the task and they are accurately being recorded. Someone else could be completing the tasks for the patient, or it could be recorded inaccurately. After all, how many times have you seen someone shake a Fitbit to get more steps in for the day? There is also a lot of bias that could come into play when gathering data with ResearchKit. For example, iPhone users tend to be wealthier, and many diseases vary by income. So, if one wants to study heart disease using ResearchKit, there may be some bias due to the fact that less wealthy people are more likely to develop heart disease than wealthier people. The population being studied may not represent the entire population of the affected people. Of course, there are many other ethical considerations that come into play with this new technology. Researchers, developers, and designers creating the apps using ResearchKit, and even the creators of ResearchKit itself, and other smart wearable devices must consider the ecological and psychological implications their designs may have on society. If the data being gathered from the studies is not valid, it could cause major impacts on future healthcare technologies and research. Designers need to consider more benefits when designing and not focus too much on aesthetics. ResearchKit applications need to be user-friendly, solve a problem, and provide some kind of benefit to the participants and researchers. Overall, these new uses and features of wearable technology in the medical field can be highly beneficial to our well-being and quality of life. Potentially, health issues could be tracked much sooner, more data on diseases could lead to faster cures, medical errors may be drastically reduced, and more. Although there are still many ethical considerations that must be taken to ensure the safety and well-being of individuals, this technology will have a huge impact on the future of healthcare and medical processes. After hearing the information presented to you today, would you still be comfortable with wearing a smart hospital bracelet containing your personal data? Would you even be willing to participate in a medical study using your smart device? Do you think that smart devices will eventually replace in-person medical studies? Can the data be trusted, or will it be as or more accurate than in-person studies? What other potential risks do you see with this new technology?